Doge is a Veneto Region project aimed at creating a network for primary care, general practitioners and specialists in children's care. The pilot project began in 2009 in the Adria Local Health Authority, ULSS number 19. The main purpose of Doge is to promote continuity in healthcare, granting practitioners immediate access to digital information regarding their patients, and to help increase the speed and efficiency of treatment. The project places patients at the center of the regional social healthcare system by making access to services easier and granting them full legal ownership of personal clinical data. Doge is a pioneering initiative as regards working methods and the outcomes that have contributed to the creation of the regional personal health record. The system was designed to be applicable throughout the region thanks to the adoption of international standards and an interoperable framework. Doge is based on 4 types of services: personal database, documentation, e-prescriptions, and privacy. Francesca has recently moved to a new town and she goes to the nearest local health authority office to choose her new general practitioner. The desk clerk consults the new regional personal database, which has been available in the province of Rovigo since October 2010, and he suggests that Francesca chooses Dr. Converso. She accepts the proposal. The clerk files the chosen name and gives her an updated Italian health insurance card. Dr. Converso is notified by the local health authority of Francesca's new, updated position inside the regional personal database and receives her medical history details and any possible health concessions. Dr. Converso, on accessing the service, receives a message and enables the system to pass on this new patient's details. Francesca goes to see her new GP who, following an initial medical examination, suggests she has an eye examination and a blood test. Dr. Converso prescribes the 2 tests using the electronic health record system, which gives him access to his patient's personal database. Prescriptions are instantly communicated to the local health authority central system, which in turn passes them on to the United Booking Center and the Analysis Lab reception system. Every day, the regional reception system collects every prescription issued by professionals in primary care from local health authority and communicates the data to the central reception system of the Italian Ministry of Economy and Finance. Francesca arrives at the blood extraction center of Adria's main hospital to have her blood test. The clerk, by introducing the number of the e-prescription into the reception system, automatically receives all the data of the prescription. The system checks among the tests prescribed that there are none which cannot be held on a digital system, as for example tests for sexually transmitted diseases. The clerk then asks the patients for formal approval to send the medical test results to her general practitioner. Francesca agrees, and while she waits for her blood test, she goes to the United Booking Center, CUP, to book the eye examination. The clerk at the booking desk puts the digital code of the e-prescription into the booking system and automatically accesses the data. The clerk suggests the first free date available for the site test and completes the booking. After the blood sample has been taken, the laboratory carries out the analysis and produces a structured report that is signed by the doctor, giving it full legal legitimacy. Then, the report is recorded inside the database of the provincial digital system, where all the digital records regarding the medical history of patients are stored. The system sends a notification to Dr. Converso that communicates the availability of the digital report about Francesca. In this way, the information is immediately available to the doctor. Dr. Converso, by using an application of electronic health record, consults the list of all notifications related to his patients. Among these, he finds the one regarding Francesca's test. The doctor downloads the report and the data are automatically put into the patient's medical diary. Francesca goes to Dr. Converso to find out the results of her blood test. Thanks to the Doge system, her doctor already has all her test data available and he doesn't need to put it in by hand, thus saving him time that he can dedicate to his patient. Once he has finished the medical examination, Dr. Converso gets hold of all the other clinical information related to his patients about which he has been notified. There are not only laboratory reports, as in Francesca's case, but also letters of discharge and emergency reports, all digitally signed. Even in these cases, the documents are sent to the doctor only after explicit approval has been given by the patient. In this way, Dr. Converso's clinical database fills up with new data that give him a complete overview of all the information he needs, while being completely in line with the local health authority. The high speed of communication allows the practitioner to act quickly and allows the system to guarantee healthcare continuity. The Doge project follows the guidelines outlined by the Veneto Region for the personal electronic health record, as defined by best practices at European and international level. Doge will be extended to all regional local health authorities, allowing the healthcare system in Veneto to reach the targets defined by the 2012 National E-Government Plan for Health, and to achieve relevant levels of efficiency and savings in medical treatment.